There are a few special differences when giving CPR to a child victim ages 1 to 8. If you are alone and find a child who does not respond, you must do 5 sets of 30 compressions and 2 breaths before you phone for help or get an AED. Also, when giving compressions to very small children, you may feel more comfortable using one hand, since you will not need to push as hard. Lastly, you will not need to blow as hard when giving breaths. Let's run through a full scene of CPR for a child. First, make sure the scene is safe for you and the victim.
The scene is safe.
Tap and shout to see if the victim responds. If the victim does not respond, yell for help.
Help! Help! I need some help!
If someone comes, tell them to call 911 and get an AED. If no one comes, do 5 sets of 30 compressions and 2 breaths before leaving the victim to call 911 and get an AED. Then open the airway with a head tilt chin lift. Check to see if the victim is breathing. Look at the chest to see if it is rising, listen for breaths, and feel for them with your cheek. If the victim is not breathing, give 2 breaths and watch for chest rise. Keep in mind, for a small child, you will not need to blow as hard. Quickly remove clothing from the front of the chest. Position the heel of your hands in the middle of the chest directly between the nipples. Now give 30 compressions. For a child, you will not need to push as hard. Press down 1/3 to 1/2 the depth of the chest. Remember to release pressure after each compression to allow the chest to return to its normal position. Give 2 breaths and watch for chest rise, and then give 30 more compressions. When giving CPR to a very small child, you can use one hand to give compressions. Place the heel of one hand in the center of the chest directly between the nipples and use the other hand to support the child's head. Continue to do 30 compressions and 2 breaths until an AED arrives, the victim starts to move, or trained help takes over.